Gosh, time is flying already. It's 6:24 in Barbados, and talking about a man who is always flying, the doctor on the line, Adrian Lord, who gets up, you know, before we get to the studio, and who hits the road. Did you know that, Katrina?
I did. He talks about his walking on mornings every morning, and I'm very proud of him.
Doctor hasn't gone home. Then I realized, no, he's got early. he's up early getting his exercise. How are you doing?
I'm pretty good. Good morning, Doug.
Good morning to you.
Good morning, Cassandra.
Katrina. Yeah.
Okay.
You have a fixation with Cassandra.
Yeah, she's gone.
She's gone but not forgotten. She'll be back. Not to worry. She'll be back.
Yeah.
Men's health. As a doctor, do you pay attention to your own symptoms, you know, or do you go to see a doctor? Do you, how's it for you?
Yeah, no, I take my health very seriously. I mean, I have to practice what I preach. You mentioned about the walking and so on, but every year I go and see my doctors. I've complained at the program before, the waiting time. You have to wait in doctors' offices when you're a patient. Shoes on the other.
Oh, you complain.
Yeah. But they facilitate me. So yeah, I look after my health seriously. I think I'm pretty dedicated and pretty disciplinarian as far as my health is concerned. And I would like men to take more responsibility for their health, because you know, all too often we see, you know, a lot of men who suffer or sudden death. We had some situations recently with sudden death. I would like to offer my condolences to the family of Elvis Reefer, who passed recently. There have been a few over the recent times. It's just that when we know one that is familiar, we get really worried. And maybe we could talk a little bit about that, because some men don't look after their health. And we don't want to talk about Elvis in particular, but the prostate problems have, which I recently saw a guy who hadn't had a prostate examination for 11 years.
Wow. When
he did his PSA, it was over 100. He has prostate cancer. And he could, I mean, there may be hope for him, but he's only 61. So things like that could be prevented. We don't know what blood pressures are, diabetes, heart disease, high cholesterol. We just go on thinking that everything is okay.
We're going to get a severe headache, then we want to run to the doctor, we want to have a blood pressure taken. I think Melissa is on the line, okay. And she has a question for you, Doc.
Good morning, Melissa.
Morning.
Morning, Melissa. You hearing us?
Morning, Melissa.
Yes, I can hear you now. Good morning, everybody.
Go ahead.
I was calling to find out what causes fibroids, and is there anything that can be done before? Because I'm still young. I have no children, so is there anything else that can be done instead of removing it while I'm still young that can ease the pain or whatever? And also, when do you have your period? Is it supposed to flow light, heavy? Will there be fluctuations in it? That sort of thing. Because right now I feel kind of drained and tired. Is that normal?
Thanks, Melissa.
Thanks, Melissa. Very good question.
Men's health to women's.
Women's health. Fibroids is a very common problem in women, and what causes them we really don't know. It is an enlargement of the muscle of the uterine cavity, which is the womb, and you can have the fibroids externally, on the outside, on the inside, or within the wall of the uterus. When they're within the wall or in the inside, they cause heavy periods and so on, severe periods and cramps, and that heavy bleeding that you get is due to increased surface area caused by the fibroids, which are most like little round balls, masses inside the wall of the uterus. As far as what can you do to treat them, the only treatment I know is the knife, to remove them. You can watch and wait. If they're causing any obstruction, then they need to be removed. Otherwise, if they're not causing any problems, then you can leave them and watch them and think. If you're at your age and you have fibroids and it's obstructing the tubes or the uterine cavity in any way, or causing heavy bleeding or a lot of cramps, or they're very large, then surgery is indicated, where they will remove the fibroids, not the uterus, because as you said, you have no children. The color of the menses is due to the clotting of the blood that is being maintained in the cavity before it's passed. So see your gynecologist, get an opinion, and follow instructions.
Well, that's a great example of someone being proactive, though, asking questions before there's a problem.
Absolutely. So, I'm impressed by that.
Yeah.
Dr. Lord, a caller just was suggesting or said that they got up this morning and they found their stool black. That's indicative of what?
Oh, well, that is usually indicative of upper gastrointestinal bleed. That is something that they should see the doctor. And upper meaning they may have a stomach ulcer or some other thing that's causing bleeding in the stomach or the upper part of the duodenum, which is the first part after you leave the stomach, first part of the intestine. And that could very well be altered blood. But the person may be taking iron tablets. And that also could cause maybe a multivitamin, that also can cause the stool to be black. So see your doctor if it's what's called Melanus stools, M-E-L-A-E-N-A, Melanus stools, then it should be checked out. And it may be necessary to have a barium meal or endoscopic examination where they can look into the stomach to determine if there is actual bleeding, and biopsy to determine the cause of the bleeding, and it can be treated early.
I want to pop back to Men's Health, Doc, and ask if you have ever come across any particular trend in reactions from your male patients about their resistance to certain types of tests. I mean, we have the PSA now, so it's not that stereotypical taboo, but that's not.
But have you ever had a biopsy? That's not a kind thing.
No, it is not a kind thing, but it's but you know, I'm curious. What are the kinds of things that people say to you when that consultation door is closed that you think to yourself, you know, it's really the mentality stopping this man from being healthy, not the illness?
Yeah, they do resist examination. Sometimes they're shy. Sometimes they don't want to get undressed, and sometimes they don't want to remove their underwear to check the genitalia, because not only should the prostate be checked, but the scrotum and the penis should also be checked. There's lumps and bumps and cysts that occur in those areas as well. But the rectal examination is thought to be your invasion of privacy.
Try being a woman.
And the women come and have the pap smears every year. So it's something that is not as bad as it looks, as it feels, as it appears to be. And when they finish, say, oh no, I didn't know that it was that simple.
I think we have Michelle on the line with a question for the doctor this morning. Good morning, Michelle.
Good morning to you.
Morning.
I am 40 years old, right? I have nursed in a church for 3 years. And lately, when I'm seeing my menstruating, I get dizzy or sometimes I faint. I went to the doctor and he gave me blood test and he said nothing is wrong. But still I'm having the same feeling. So I want to know what's the problem.
Well, it seems that you're having heavy periods, and possibly it's interesting that you had blood tests. I'm not sure what blood tests you had, but if you had a blood count, I'm sure it should have said that you were anemic. It sounds to me that you're having heavy periods, you are anemic, or you're losing too much blood at that period of time, and you may need iron supplementation. So you may need to get some iron tablets to help to correct that, and of course check your doctor and see if that is the cause. But that is the most likely cause, anemia, which is a low blood count as opposed to low blood pressure.
It is interesting, and I don't know if this is a real gauge of society, but the only two calls we've had this morning are from women. We want the men to call in now, and all of the we have Leslie. Leslie is male or female? Good morning, Leslie.
Leslie is a male.
That's
all
right. Good morning, Leslie.
Thank you very much for calling, Leslie.
Right. Good morning, everybody.
Morning.
Good morning, Doc.
Morning.
I've seen my doctor, they had a blood test and thing. I drink alcohol. I don't longer drink alcohol, but she told me that my liver was a bit damaged and it could be repaired. My question is, how long does the process take to repair that damage?
Well, it depends on the degree of damage that you have done to the liver. Alcohol can cause a fatty liver, which after any alcohol bout of alcohol, the liver becomes a little swollen. But if you repeatedly drink alcohol, and from what you say, you drink alcohol, so that you drink a lot of alcohol, and you've been doing it for a long time, then you can lead to cirrhosis, which is further damage and fibrosis and damage, more of a permanent type of damage. But based on what your doctor said that it can be repaired, it looks like if you remove that toxin from the liver, the alcohol, your liver will regenerate itself. And it's a very large organ, so it will take some time. I can't give it a time period, whether it's 6 months or 1 year, but if you, doctor told you it's damaged, keep away from the alcohol.
Well, at least this goodly gentleman wants to find out how to make wrong things right, as they say. We have another lady. Good morning to Nicole.
Hello.
Hi, go ahead, please. What's your question?
Good morning. My son is 13 years, I took him to the doctor for a pain in the testicles. Well, the doctor told me it can be infected or the testicles may be tied in a knot. Can you explain this to me?
That could be infected or testicles.
Can you give us that second part again, please, Nicole?
Oh, his testicles could be tied in a knot.
Or tied in a knot, or
Yes,
twisted. Yes. Infection in the testes at that age, 13, is highly unlikely because usually an infection can be sexually transmitted. So unless he had some other congenital abnormality, born with some other abnormalities, it's unlikely that an infection would be in testes. Torsion of the testes, which is the twisting of the testes. The testes is a little ball on a string, and if you twist it, then this blood supply can be impeded, and therefore it can cause pain. Sometimes this torsion can cause severe pain, and if not undone, can lead to damage and even death of the testes. So it can be a surgical emergency. But if this problem is occurring and recurring, the doctor needs to be seen, a urologist might need to be consulted, and there's surgery that can be done to untwist it and keep both, not only that one, but the other one stable to prevent further problems. Because if it is damaged, then it would affect his sperm count and fertility later in life. So it's better to have a look at it now.
I know we have Jackie holding, and I'm just going to crave her indulgence. As a follow-on to that question, what should the parents be looking for health-wise for young teenage boys who are kind of growing into their skin with these long gangly limbs and figuring out all sorts of things out? That transition from puberty to teenage, what should parents be looking for? Because teenagers and young children are not necessarily as physically self-aware as adult males would be or should be.
I think you're talking about the secondary sexual characteristics which tend to develop. The pubic hair starts growing, and the genital organs develop a little bit more, and of course you start getting that body hair and the deepening of the voice, which are some of the characteristics of a secondary sexual.
Now, what is out of the ordinary to look for?
If there are cysts or swellings of the testes, if there are hernias that may be developing, things of that nature, one should get checked for.
All righty. Jackie, what's your question, please? Good morning.
Good morning to everyone.
Hi.
Morning.
Doc, at night when I lay down, I just go to sleep pretty all right, but between 3 and 4 in the morning, I just got a terrible headache and I have to get up, sit down, or walk around. Can you tell me the problem?
No. It's really difficult to say what will be causing that headache. I don't know if it's something that she's eating at night or drinking, maybe coffee or whatever, or from not eating if the blood sugar drops too low at that time of the morning. But it's very difficult to say what is causing that severe headache. It might be a type of migraine. Some people do get migraine. Some trigger may be causing migraine to cause them. So by trial and error, you need to find out what is causing it by changing your diet, by sleeping in different places, different positions, not eating too late before going to sleep, changing the types of foods that you eat, and see if any of those things contribute to that so you can have a good night's sleep.